Hi everyone, this is my Crohn's disease case presentation. A 16-year-old female presents to the ED with right lower quadrant abdominal pain, bloating, loose semi-formed stools, fatigue, anorexia, and weight loss. Her parents are amid a divorce and the patient endorses a recent increase in her stress level. Blood work and a stool sample are sent for analysis. Her blood work is remarkable for vitamin B12 deficiency anemia, elevated anti-neutrophil cytoplasmic antibodies, elevated anti-Saccharomyces cerevisiae antibodies, elevated CRP, and elevated ESR. Her stool sample is negative for pathogens but positive for calprotectin. An MRI of the patient's abdomen is done, which is remarkable for transmural inflammation and granulomas. The patient is subsequently diagnosed with Crohn's disease. A GI specialist is consulted and explains the disease and course of treatment to the patient, including initiation of mesalamine, methotrexate, and steroids for her current flare-up. She is also started on monthly vitamin B12 injections to improve her vitamin B12 deficiency anemia.